Hi, I'm Dr. Paul Harch. I'm a hyperbaric physician who's been practicing and doing research in this field for 34 years, and I have some important information I want to show on treatment of coronavirus patients in respiratory failure using hyperbaric oxygen. This is a recommended protocol that we put in front of our institutional review board that's a distillation of information from two sources. One, a Spanish flu experience here in 1918, and secondly, from doctors in China who treated coronavirus patients. This is not a recommendation for medical treatment. This should be done only by hyperbaric physicians who are trained in the delivery of hyperbaric oxygen in a controlled medical environment. Our protocol: 1.6 atmospheres of oxygen for 60 minutes at depth, once a day for 3 to 8 treatments. The endpoint is maintenance of oxygen saturation at 94% or better on or off oxygen. Where did this protocol come from? Two sources. Historically, Spanish flu patients, first ones treated with hyperbaric oxygen in the United States. It was in 1918. And the Spanish flu and the COVID-19 patients in Wuhan, China. Spanish flu patients, Dr. Orville Cunningham in Kansas City was brought moribund, cyanotic Spanish flu patients, and he treated them at 1.6 atmospheres for just an hour once a day for 5 treatments. Ended up saving all of these patients. The Chinese, after extensive communication and review of their data, treated 35 patients, 6 of them severely ill, 1 on a ventilator, 5 on mask oxygen. Of the 29 less severely ill, they were treated because the patients saw the sick ones improving so much. They went to the hospital administration and pressured them, if you will, to pressure the hyperbaric doctors to treat them. All 35 were discharged from the hospital well. The first one, the ventilator patient, critically ill, intubated, had 4 hyperbaric treatments at 1.6 atmospheres for 100 minutes. The second patient, which was the most severely non-ventilated patient, they treated at 2 atmospheres, 90 minutes at depth first treatment, then 60 minutes for 7 treatments to follow, all once a day. And this one had the least improvement on a day-to-day basis. I think it may have been due to that 2 atmosphere dose. All of the other 4 were treated at 1.6 atmospheres, 90 minutes first treatment at depth, all subsequent on 60 minutes. 2 of them only required 3 treatments. And here's the graph of their oxygen saturation. If you look at this, this was the oxygen level before they went into the chamber each morning for each of the hyperbaric treatments. This is the level right as they came out. What they didn't show is that this value drifted down, but eventually stabilized, actually drifted down within about 2 hours, but stabilized by the following morning at increasing levels until they came to plateau. Considerations: infection control. You have to protect your staff, you have to protect other patients, you have to do this properly. Number 2, medical staffing. This needs to be done by medical professionals who are trained and experienced treating hyperbaric patients and patients in respiratory failure. Number 3, the Chinese patients were only on 50% oxygen mask. They didn't have non-rebreathers like we do in the United States, and that's something to consider here. And the last thing is there's difference between doing this in a monoplace and a multi-place chamber, and you have to be careful with that. And I'll give this information and put this out on some subsequent videos. Thank you.